Om Dham Dhanvantare Namaha. Karpura Gauram Karunavataram Samsarasaram Bhujagendraharam Sadavasantam Hridayaravinде Bhavam Bhavani Saitam Namami. Let me share. So today's topic is Drakshasava, its clinical indications. So most of the fermented products are the pharmacy, pharmacy division, that is Asava aristas, which are widely practiced in Ayurveda, popularly given and prescribed by Ayurvedic physicians. So in the treatment, one Asava arista also given in the prescription, Asava arista, leha, tablets, pills, etc. are given according to the disease conditions. So fermented products and formulations are used in the clinical practice. Asavarishta preparations are formerly used by Ayurveda physicians in the management of various disorders in modern India. Asavaristas like Balarishta, Ashokarishta, Ashwagandharishta, Abhayarishta, Chandanasava, Chavikasava, Dashamularishta, Chitrakasava, Dantirishta, Eladirishta, Jerakarishta, Kutajarishta, Kanakasava, Kankustasava, Lohasava, Mustakarishta, Purnanamasava, Pushkaramulasava, Sarivadhyasava, Sarasarishta, Ushirasava, Vidangarishta and Vasakarishta are few Asavarishta formulations which are commonly used by physicians. Asavarishtas are Sandhaniya preparations which are prepared by fermentation process. Since they contain 9.5 self-generated alcohol, can be preserved for prolonged period also. Drakshasava is one such preparation which is given in Agrimandya, Karshya, anemia, constipation, debility, and general weakness. It is Shaktivardhaka, Malavatanlomana, digestive, Virechana, anti-anemic, Rasayana, and immunomodulator. And also Balya, Brahmana, Jivani, and Ojaskara also in action. The present paper highlights about the clinical indication of Drakshasava in scientific and experiential view. So, Drakshasava is a fermented formulation. It is used generally as a tonic and in chronic debilitating diseases. It is also given in disorders of indigestion, aruchi, dorbalya, malabandha, and insomnia. This mainly contains draksha, grapes, and sharkara. The draksha is madhurasakta, Chitavirya, Balya, Brahmana, Jivaniya, Ojaskara, Shaktivardhaka, and Vatapittahara in action. Sharkara is Madhurasayukta, Rasayana, Balya, Brahmana, Ojaskara, Jivaniya, Vayastapana, and immunity booster also. As it contains self-generated alcohol, it can be preserved for about 10 years. Ingredients of Drakshasava: Draksha, wood or jaggery, water for decoction, and prakshepaka dravyas like ela, it is cardamom, dalchini, cinnamon, tejapatra, cinnamon leaves, maricha, black pepper, pipali, piperlongum, vidanga, embellia, tribes, nagakeshara, mejua feria, priyangu, calicarpa, macrophylla, and datiki flowers, woodfordia, fruticosa. So now let us see the actions of the ingredients of Drakshasava, or in total actions of Drakshasava. They are Deepana, Pachana, Balya, Brahmana, Rasayana, Aruchinashaka, Malavatanlomana, Sramahara, Krishnahara, Raktavardhaka, Virechana, immunity booster, Karshahara, appetizer, carminative, and carminative. So these are the actions, isn't it? Then, so you see in the brain it acts. It usually sedate or depress the central nervous system. The reticular activating system also depressed, isn't it? This is a cerebral histology. You can see gray and white matter, isn't it? So in these neurons, the epinephrine, non-epinephrine, dopamine, these neurotransmitters are decreased, activity is decreased by Drakshasava as contain alcohol, isn't it? Cerebrum, there is many layers of the cerebrum in the cortex, isn't it? There are so different types of neuronal cells and supporting cells are in the brain. So Drakshasava acts on the brain also, and it will depress the CNS system and reticular system. Isn't it? It will decrease the sympathetic activity. Isn't it? The catecholamines activity is decreased by Drakshasava. This is stomach. It stimulates stomach. You can see the histology of stomach. So isn't it? The mucosa is lined by pulmonary epithelium, and mucosa secretes mucus. There are some cells, chief cells. Chief cells secrete oxyntic cells. Oxyntic cells secrete HCl, and chief cells secrete pepsin, isn't it? In stomach. This is also stomach in another area. So as you can see, the gastric pits are gastric glands, which is lined by mucous cells and chief and oxyntic cells. Chief cells secreting pepsinogen, oxyntic cells secreting HCl. This is duodenum. You can see the villi. Villi is responsible for the absorption of the nutrients, digested products, isn't it? So this acts also on the duodenum and increase secretion and increase appetite and digestion also. Raksha, the fruits are dried in the sun and it is used, pasted, and it is the cooking pepper, and Draksha is done. Draksha is added to the water and Sandana is done, isn't it? So Draksha vitis vinifera. So Zataki, Woodfordia floribunda, that flowers, dried flowers are used for fermentation. Is when the water and Draksha and Kalkas, the Bhakshavidyas are mixed, then it is Satik Pushpa is put in the superior upside, and it is the Sandana is done, isn't it? So let us see the clinical indications of Drakshasava. Agnimandya, Ajirna, Aruchi, Malabandha, Adhovata, Admana, flatulence, Kuchishula, Daurbalya, Karshya, emaciation, Kasa, giddiness, Jararoga, insomnia, irritability, Unmada, mental depression, and anxiety neurosis. This can be treated by Drakshasava. However, we have to add suitable add-on therapy or adjoints along with the Drakshasava. Now, Amayaka Prera. When Drakshasava is given in various other formulations as needed in the disease management, it will give desired results. Like in Agnimandya, it is used with Hinguashtaka Churna or Lashanadivati. In Ajirna, it is given with Lavana Churna and Akantandivati. Aruchi, in Aruchi, it is given with the Hinguashtaka Churna. In Malabandha, it is given with Triphala tablets and Trivitleha. In Adovata, it is given with Triphala tablets and or Ashwakanchakirasa. Ashwakanchakirasa contains Jayapala and it is a drastic purgative that will give in caution, isn't it? Admana and same medicines. Atopa is given with Amrindivati and Abhayarishta. In flatulence, it is given with Kupilingvadvati and Abhayarishta. In Kukshishula, it is given with Nabhivati and Pravapatambarasa. In Daurbalya, it is given with the Kushmandavaleha. In Karsha, it is given with the Ajamsarasayana and Ashwagandharishta. In emaciation, it is given with Mamsarasa or Ajamsa Rasayana. In Kasa, it is given with Lavangadivati and Sitapaladi Churna. In giddiness, Brahma, it is given with Lagusuta Shikaravati and Sarpagandhavati. When suppose there is a loss of sleep, that also causes Pitta Vriddhi and Vata Pitta Vriddhi and giddiness. So you have to give Lagusuta Shikaravati and Sarpagandhavati. In Jararoga, it is given with Makaraja pills and Chavanprasharaya. Makaraja pills is a stimulant, it is a CNS stimulant, and it also strength promoter, increasing strength, isn't it, in the body. Especially in old people, it is very useful. In insomnia, it is given with the Sarpagandhavati or Tagara tablets. In irritability, it is given with the Manasamitravata and Sarasasarishta. In Unmada, Paithika Unmada like mania, it is given with Shirodhara and Sarpagandhavati and Medhyavati. In mental depression, Kapaja Unmada, it is given with the Lagusuta Shekaravati and Puga Khanda. Puga is a CNS stimulant, isn't it? It will increase the catecholamine activity in the brain. Anxiety neurosis is given with Tagara tablets and Jadam Sirna. This will have anxiolytic action also. Okay. Coming to discussion. Drakshasava is a Sandhaniya formulation. It is used as a general tonic and rejuvenant by Ayurveda physicians. It is usually given in Agnimandya, Ajirna, Malabandha, Kasa, Anaha, Admana, Atopa, Dorbalya, and insomnia. It is having the actions like Dipana, Pachana, Malavatan Lomana, Vatapitahara, Valya, Brahmana, Ojaskara, Jivaniya, Rasayana, and Shaktivardhaka also. When it is given along with Dashamularishta and Kumaryasava, it works as a best strength promoter. That's it. Strength promoter and Brahmana also in adults and in children also. When it is mixed with Dashamularishta alone, it acts as an appetizer and digestive, good appetizer and digestive. It can be preserved for about 10 years after the date of preparation without alteration in potency. Coming to conclusion, Drakshasava is a Sandhaniya preparation which is usually given in debility, anorexia, and emaciation. There are least adverse drug reactions after giving this formulation for prolonged period also. However, if you give an empty stomach without adding water, if you give an empty stomach in larger dose, it can produce irritation, gastric irritation, and symptoms of amala pitta, isn't it? But it usually administered after mixing it with water and is taken after food. Otherwise, it may induce burning sensation in the abdomen and sore irritation. When given with suitable adjoints, disease-specific adjoints, it produces desired effects in various disorders. So these are the reference. Thank you for patient hearing.